Hello students, in today's video you'll be learning about gross pathology of multinodular goiter. So before we go into the detail about gross pathology of the multinodular goiter, let me explain you about the disorders of thyroid. So what are the disorders of thyroid? Hyperthyroidism, hypothyroidism, thyroiditis, diffuse multinodular goiter, neoplasms like adenoma and carcinoma, and congenital abnormalities. So what is goiter? It's a diffuse or focal enlargement of the thyroid gland caused by colloid goiter, Graves' disease, thyroiditis or tumor. So it's divided into two types, simple goiter and familiar goiter. So what is simple goiter? It is an enlargement of the thyroid gland when a patient is in euthyroid state without any neoplastic or inflammatory process, and familial goiter caused by inherited enzyme defect. There are two stages, hyperplastic stage and colloid stage. So multinodular goiter is due to uneven hyperplasia and accumulation of colloid when there is repeated attacks, which will cause rupture of the follicles. So symptoms are often mild and diagnosed by the thyroid hormone test. Low TSH, that is a thyroid stimulating hormone, and T3 T4 hormones are elevated. The pathophysiology is when there is iron deficiency and goitrogens which affect the normal thyroid by iron deficiency, where there is reduced T4 and T3 levels and there is increase in the TSH level, the thyroid stimulating hormone, which will cause diffuse enlargement of the thyroid gland. So there is heterogeneous growth of thyroid follicles, ischemic necrosis of expanding follicles, and scarring, which will lead to non-toxic multinodular goiter, where there are many nodules in the thyroid gland. Non-toxic nodular goiter, multinodular goiter, becomes toxic multinodular goiter when there is TSH receptor gene mutation, functional autonomy of the thyroid follicles. The non-toxic nodular goiter causes hypothyroidism where the thyroid hormones are low, whereas toxic nodular goiter causes hyperthyroidism. So it's caused by one or more thyroid nodules which traps and organifies more iodine and secretes more thyroid hormone independently of TSH control. So it's more common in areas of endemic goiter. Hypothyroidism is milder than Graves' disease, not accompanied by ophthalmopathy, myxedema or vitiligo. This is a picture of a normal thyroid. You can see both the lobes, right and left lobes. The arrow showing on the top is the lobe of the thyroid, and in between you can see the isthmic part of the thyroid. It is measuring 4 cm. The thyroid lobes are measuring 4 cm in length and there is no nodules on the external surface. This is a picture of a simple nodular goiter where you can see simple cyst. The cyst you can see on the right side and the left side. There is a large cyst on the left side. This is a diffusely enlarged thyroid with multiple nodules on the external surface. This is also another picture of a nodular goiter. So this specimen will be kept as a spotter in your exams. So how do you diagnose this as multinodular goiter? So you confirm this as thyroid gland when you see a butterfly shaped organ. You can see the asymmetric enlargement of the thyroid gland, and this is a cut surface of the thyroid gland showing multiple nodules which are filled with gelatinous colloid. So how do you write the description? So the identified spotter is multinodular goiter or a thyroid gland with multiple nodules, and cut surface showing multiple cysts or nodules filled with gelatinous colloid and separated by fibrous septa.